So Ruth, now what I would like to be doing is to breathe slow. We're going to bring together, breathe nose, low and slow. And it's also very important in terms of helping to bring a calmness to the mind and to reduce any agitation that might be going on in the mind. It can be useful to put your hands either side of your lower ribs. So this way then you can connect into breathing low and allow the shoulders just to relax and just kind of settle into your breathing. So it's always best to have a passive approach. We're not looking for perfection with breathing. We're just looking to gently work with it. So as you breathe in, your ribs gently move out, and that's perfect. As you breathe out, your ribs are gently moving in. And now I'm going to time it. I'm actually going to start you off with breathing in for 2 seconds and out for 3 seconds. And this is just, it would be easier for people with a lower control pulse to start off with this frequency. So we'll breathe in for 2 and we will breathe out for 3. So as you breathe in, your ribs move out, and as you breathe out, your ribs are moving in. So there's your breath in, 2, out, 2, 3, silent. In, 2, out, 2, 3. 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 Keep with that, and just a little bit lighter. So we keep with that frequency. In, 2, out, 2, 3. In, 2, out, 2, 3. It's better. In, 2, out, 2, 3. 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 Take a rest. So that's slowing down the breathing rate to about 12 breaths per minute. Now, it's a pretty good rate to start with, especially if we're up at 18 breaths per minute.
Okay.
I often feel that it's a mistake for, if say somebody was breathing 18 breaths per minute, to all of a sudden go down to 6 breaths per minute. It's such a drop. So starting off with 2 seconds in and 3 seconds out, with lateral expansion and contraction of the lower ribs, breathing nose, breathing silent, but also breathing light. So at the start, it's very normal that you might notice that your breathing is a little bit fuller, and then you just gently bring a lightness to it. And that's what you did.
Okay.
So now what I'm going to do is have you breathe in for 3 seconds and out for 5 seconds. And if you notice that the exhalation is about 1.5 times the length of the inhalation. So at the start, it was breathing in for 2 seconds and breathing out for 3. So that's helping to evoke a relaxation response. With this one, we're breathing in for 3 and we're breathing out for 5. So again, hands either side of your lower ribs, and it's nose, it's silent, it's light, it's slow, it's low. And now you're having your exhalation, 2, 3, 4, 5, in, 2, 3, out, 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 2, 3, 4, 5, better, in, 2, 3, out, 2, 3, 4, 5, in, 2, 3, out, 2, 3, 4, 5, in, 2, 3, out, 2, 3, 4, 5, in, 2, 3, out, 2, 3, 4, 5. Okay, perfect. Now, I don't always count by seconds, so just, I'm sure some of you are looking at your stopwatches and you're saying, well, he's counting the seconds quite fast. Don't worry about that. What I'm looking to do is more to find the ratio. And I'm also looking to get a balance between nose, slow and low. So for example, when Ruth has her hands either side of her lower ribs, we want to see a greater engagement of the diaphragm and less movement from high. But we also want that when she slows down the respiratory rate, we don't want to see a disproportionate increase in tidal volume. In other words, it's very common when the focus is solely on the respiratory rate that the size of each breath increases disproportionately, and the risk here is that it will cause an increase to minute ventilation. That would mean that the person then is likely to be hyperventilating, and that in turn is not what you want, because that's only going to make your breathing worse. So it's always a balance. So yeah, don't worry about the timing. Is not perfect. As I said, none of these exercises, don't look for perfection. It's about gently working with them and having a passive approach to it. And more important is a feeling of relaxation and giving it a go. So we started off with 2 seconds in, 3 seconds out, 3 seconds in, 5 seconds out, and now we will do a count of 4 in and 6 out. And this is bringing the respiratory rate down to 6 breaths per minute, which is a very good breathing rate to practice to help stimulate the vagus nerve and to help to bring balance to the autonomic nervous system. So now we're going to do 4 seconds in and 6 seconds out. So you have your hands either side of your lower ribs. You're allowing your shoulders to relax. And you're always thinking about breathing nose, breathing light, breathing slow, breathing low. So whenever you're ready, there's your breathe in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6, in, 2, 3, 4, out, 2, 3, 4, 5, 6. A little bit more lower. And as you're breathing in, you're feeling the ribs moving out, that's it. And as you're breathing out, you're feeling your ribs gently moving in, that's it. So it takes some degree of focus. As you breathe in, your ribs are gently moving out. And as you breathe out, your ribs are gently moving in. So reduce movement from the chest. And as you breathe in, you're feeling the ribs moving out, that's it. And as you breathe out, you're feeling the ribs moving in. Okay, excellent. Great. So we'll take a rest.